All right, I am always happy to have Jennifer Cabrera on with us on Daybreak, 92.5 Fox News. She's the editor of the Alachua Chronicle, contributor to Rational Ground. RationalGround.com is the website. And I'm so happy that she's getting up early with us. Good morning, Jennifer. How are you?
Good morning. I'm fine. How are you?
I am fantastic. Trying to keep track of everything that's going on COVID related because it's dizzying sometimes when you hear some of the things that are being said as opposed to what is out there. Can I give you some of the things that are on your Twitter account that are dizzying, and maybe we can comment on this together? Is that okay? Can I go through some of this?
Sure.
Okay, so trying to figure out, are we trying to get to herd immunity? Are we getting to immunity because that's a good thing when it comes to COVID? That's where we want to be. Or is it 15 days to stop the 30-day spread, to have kids out of school? Because I don't really know how all of that goes. But when I see Dr. Tom Frieden putting out a tweet that says the higher the proportion of people with immunity, either through vaccination or infection, the stronger the selective pressure on the coronavirus to mutate in ways that can evade our immunity. I'm not a doctor. I play one at home, but that's a whole other story. But that doesn't seem like that's right to me. Did that seem weird to you, seeing that tweet?
Well, so I'm not a doctor either, but plenty of doctors and immunologists and all kinds of people on Twitter yesterday said that is absolute nonsense.
Yeah. Just
nonsense. If that were true, see, bacteria can do this. They can evade things, that's why they tell us not to use hand sanitizer so much and that sort of thing, because bacteria do that. But if viruses did, then all of our vaccinations would be nonsense, would be useless. So
right.
Measles would not have been pretty much, eradicated. Smallpox would not have been pretty much eradicated. So it's just crazy.
Yeah, it's odd. Also, anytime I see the governor of the great state of Florida, Ron DeSantis, on the news on certain outlets, and I see his name pop up, I know what's going on. It's the attack against this state, as we're avoiding some of what's happening in maybe some other states. I don't know, I'm going to throw New York out there as an example of some of the things that Andrew Cuomo did in the state of New York when putting positive patients back into nursing homes, and what has happened, and some of the information that we're starting to find out now. But when it comes to vaccinations and vaccines and what's happening here in the state, can you give me like an overview of what our numbers are looking like, what's happening in the state, and even overall what's been happening as far as cases and deaths are concerned?
Well, sure. We're doing very well on the vaccinations. I don't really look at all the things that compare us to other states, but we've vaccinated right now about 2.3 million people, which is over 10% of the state. And 1.1 million of them have gotten the full series, and that's really, I think we're getting up on maybe 40% of seniors vaccinated, and it's higher in some counties, and that's really encouraging. Let's hope this continues to work. It's unclear yet whether it's having any effect on the data. We just can't tell.
Yeah.
Pretty much everybody is in the same free fall that's from seasonality right now. It's just we're on the downside of the curve anyway, so very hard to tell. I could say that I watch every day the percentage of new cases that are in the 65 plus age range, and it's stayed pretty the same. So I don't know what that means, but it's got to be a good thing in the long run to get the vulnerable vaccinated, and I think DeSantis has taken the right tack there. In terms of cases, we're just in free fall. Yes, we're still finding cases because of the way we test, but the positivity rate in many counties is dwindling to very right around false positive rates, and the whole state's average on false positive, not a false positive, but a positive rate
right.
is right around 7%, which is, but that's about as good as it gets for the state as a whole for whatever reason.
Yeah. Now, by the way, Jennifer Cabrera joining us on Daybreak, 92.5 Fox News, editor of the Alachua Chronicle, and also contributor there at RationalGround.com. I wanted to ask you this too, because, a lot of times we have people that are looking at the numbers and the cases as they're going down and trying to figure out, looking at correlation and seeing all of these vaccinations taking place. But then you have some people that are confused about when we're talking about the positivity. Remember, we talked about this, I think it was last week, in the PCR test, and how there's some confusion out there as to whether or not they've changed the protocol and the numbers when it comes to the load there that you are going to take on the swab, and how you're going to come up with these the test results, and how the numbers have been lowered, or have they been? Can you explain a little bit? Because people are saying that, well, the numbers are going down because they changed the dynamics, the numbers that have to do with the PCR testing, and so that's why all these false positives are going down, so the cases are going down. But that hasn't been done, right?
Correct.
Okay.
There was some memo or something that came out from WHO, I think in January, and it said, here's some changes that should be made to the PCR test. And everybody said, oh, look, just in time for Biden to change it, to declare victory, which, by the way, he doesn't seem in any hurry to declare victory over. They seem to be wanting to extend it forever. But side point. Anyway, as far as we can, so in the United States, all the tests are authorized under emergency use authorizations. There's nobody that with a stroke of a pen can change how many cycles they're run. There's over 200 tests. They would each have to go back through the FDA. So as far as I know, only the Kansas Health Department has actually changed the number of cycles they're running. So what we're seeing is a true seasonal drop in infections. The reason we know this, we don't need to know anything about the PCR test to know this. There's two huge indications. The one that I always point people to is called CLI. It's the number of emergency department visits for COVID-like symptoms. And CDC has a graph of the national, Florida. It's dropping everywhere. So this has nothing to do with testing. This is people that show up saying I'm sick. Right. So that is your best indicator of what's going on in your community. Are people showing up saying I'm sick? And that is dropping everywhere. It's dropped from, it was on 7.9% of emergency department visits were for CLI in Florida on January 3rd. That was our peak. And we're down to 3.6% now. So that's just been a massive drop. And then hospitalizations are very similar. They peaked on January 13th in the highs, like 7,700, somewhere in there. Mm-hmm. And we're down to 4,700 hospitalizations for primary diagnosis of COVID. So those things have absolutely nothing to do with PCR tests.
Right.
But they're way down.
And the other thing that everybody asks, and I'm sure they say the same thing to you, is what in the world happened to the flu? Like, where is it? Where did it go? Because you have one side that's saying, Drew, come on, we know exactly where it went. It's gone because everybody's washing their hands, they're wearing masks. That's why it's gone. When people say that to you, what do you say?
I don't think anybody knows where the flu went. I have not asked a single person that claims to actually know where the flu went, but it is gone, and it's been gone before we even really knew COVID was. Before we knew the extent of COVID, before we started locking down, it's gone. Not only is it gone, did it disappear before we did anything? It's gone everywhere. It's gone in places where there's no COVID either. Like, for example, Australia, where they've pretty much kept it out with, massive border controls. Still, even when there's no COVID in the population, there's still no flu. So we don't know. We really do not know. And the main theory is a kind of a viral interference theory where one virus shuts out another. But again, if you don't have COVID, how does that make sense? I don't think anybody knows, except that viruses, there's a whole paper on how they start in Southeast Asia. And I never knew this. Did you know this? Apparently, almost all the new viruses start in Southeast Asia, and then they work their way around the world. And so what happened is maybe this year nothing started, right? So it was shut out in Southeast Asia by COVID. So it never started. And I don't know. I'm just telling you what people have told me, because nobody claims to know. Right.
Yeah. Well, no, I trust you. I trust you that you're hearing this from people and nobody knows. And so that's why I'm asking you. It's like, it is fascinating because people are trying to rationalize exactly what's going on and figure it out. And like you said, nobody knows. So here's something I wanted to talk to you about because I've been passionate about this. I believe you would be or are as well. I'm going to find out in just a second. All right, Jennifer Cabrera, here we go. I am concerned about the state of Florida, and I'm concerned about when we have a legislature that may allow for some of the things that I believe would be unconstitutional. I would love to see the state legislature take on the federal government and say, no, we will not. We refuse to do anything that the federal government is going to have us do here as a state that we deem to be unconstitutional, flat out, that we are going to protect this state and we're not going to do things that are unconstitutional. It's just not going to happen. But on the other side of that, giving the government and giving the state the power to forcibly mandate vaccines or to forcibly mandate during emergencies, we're going to have to revisit this, Jennifer. We're going to have to talk about this in the legislature. And dare I say, this is going to have to come out in the open, no matter how it started or when it started or what is going on with this. These emergency actions can get out of control. What do you say about that?
Oh, I think I'm very discouraged that from what I'm seeing, the legislature does not seem to be as passionate about this as we are. They need to be working on this. They need to get rid of that vaccine, that ability to mandate vaccines, and they need to be working on the ability for emergency orders and how long they can last and what constitutes an emergency. And, pushing back on all these executive orders that are coming down from the federal government. And I don't know how all that works. But I think these are what I'm seeing my local legislators just, going through their normal bills. And I'm like, this is so important and it needs to be done and it needs to be a top priority. And I think the governor realizes that to some extent, which is pushing some of it, which I need to tell your listeners about something called FUAMI. Do you guys know about FUAMI?
About who?
FUAMI, Floridians United Against Mandated Insanity, FUAMI.org. Now, they have a petition that they're trying to get 1 million signatures on by the middle of March. And the petition at this point is to ask Governor DeSantis to remove all of the local mandates, no curfews, no mask mandates on businesses, just remove all of the local restrictions. That's the first step, is just to ask the governor to do that. And so we're trying to so please go to FUAMI.org and sign the petition there. That's a very simple thing to do if you live in Florida. It's very helpful to us, and spread the word about it. And then, but we're also going to be, once we get past that point, we also want to continue to look at all of these things, all of this emergency order stuff, all of these things that have put unconstitutional requirements on Floridians.
Yeah, that's something that I've talked about with my local legislators, and I'm insisting that something be said, something be done, something be put out there to talk about this, because as you know, we know here locally the concerns that many people have about mask mandates that certain county commissioners want to put forward and have been, and we know, and you have done such an amazing job of showing mask mandates versus non-mask mandates, whether it's states or even in counties. We can do it here in the state of Florida and see how there is no difference and forcing people to do this. The school issue is such a huge, and thank goodness the governor here, we're not dealing with it the same way that they are dealing with it at a national level. But that concern about pushing back and the narrative that he has done something here that is so wrong with schools, the CDC, maybe you want to talk about that, Jennifer, the comments of the CDC and the back and forth and the teachers unions, and how it just feels like the Biden administration is just going along with the unions when it comes to having kids on a national basis going back to school, back to the classroom. We have the examples of how it works. I mean, if you're looking to find out what would happen or what the cases would be of the situation, we have the situation here in the state and the success of having kids and how important it is to have them in the classrooms. And yet we've got a federal government that and CDC that's pushing back. And then you ask yourself why. Maybe you want to comment on that.
Sure. It is so important to have schools open. And I think more kids should be in school. I think, I understand there's a big thing to offer the options now, but I think so many people are out of school out of fear. and that we should be addressing that with more leadership. But anyway, yes, Florida, as we all know, has been open since August. Sports has gone on. Nothing crazy has happened. Florida is performing overall. The fear is you put kids in school, they give it to their teachers, they give it to their families, it increases community spread. That's what the CDC is saying now. There's no evidence of that in Florida. Florida has done better than states that are far more locked down. So the national press is just ignoring that Florida has actually been in school since August. And the CDC has had school opening guidelines since last summer, which many states followed. And a lot of Midwestern states have had open schools also. And Texas has had open schools, and Georgia, a lot of the South. And so it's all been fine. There's nothing terrible has happened for schools being open. And so even last week, CDC Director Walensky was saying, schools are perfectly safe. I think schools should be open. And then all of a sudden this week they come out, or Friday afternoon, I guess, they come out with, after talking to teachers unions, apparently, you have to meet all of these standards to be open. And by these standards, only 5 counties in America would have open schools and school sports at all levels. And that's just crazy, because obviously all of Florida is doing it just fine. But they don't want to look at it. This has been the case all along with our public health officials, is they look at models and not data. If you look back at the data, you see that there's no correlation between open schools and community spread. There's just not. We've got tons of studies. We've got studies from all over Europe. Europe has not closed schools. In fact, schools in Norway and some schools in Sweden don't even have masks. There are mask optional districts in Florida and in Georgia and in other places in America. And again, nothing terrible happens. I mean, we have to go past open schools to not masking our kids. It's horrendous. But anyway, that's kind of a separate topic.
No, I know.
But I mean, this is what they're saying is, like, you can open schools, but only if you meet all of these insane metrics, and you 6 feet apart, and you mask them, and you contact trace. And I mean, it's insanity, although a lot of it is actually what's being done in Florida schools. But at least we're open.
Right.
So you have to start somewhere.
Yeah. No doubt. All right. Jennifer Cabrera joining us on Daybreak 92.5 Fox News. You can follow her if you would like on, Parler's up and running again. So if you want to go to Parler, you can go to. I need
to start posting there.
Yes.
Again,
Yes. Jennifer Cabrera. She's a Parler there. If you want to go to Twitter, that's fine. J. Haskins Cabrera. You can follow her there as well. The editor of the Alachua Chronicle and contributor to rationalground.com, the website. And we always appreciate a few minutes, Jennifer. You're the best. We'll do this again soon.
All right. Thanks, Drew.
All right. We'll see you.